This is our mechanism to be able to talk directly to our members in the fire stations with a special guest each month. Along with that, we'll answer a couple of the questions that come from the field to complete the communications loop, to give you information that you may not have, and to be effective as much as we can, to be clear, transparent, and in a way that again gives you great information at the fire station level. What an incredible guest and information we have for you today. Joining me will be a paramedic, Miss Jessica Krause, and she's going to talk about our community paramedicine program. Jessica, how are you doing today?
I'm great. How are you?
Good, very good. Tell us a little bit about you, first of all.
So I have been a paramedic since 2005. I've been on the fire department since 2008, so coming up on 15. So I've been in EMS over 20 years. I got my paramedic in 2005, and I've been on the department since 2008, so just past 15 years in October. And I'm married. I have a daughter and a crazy house with a mother-in-law and a niece, a couple nieces, and a couple dogs. So
Sounds fantastic. And time always seems to fly. Did I say that right? It
does. Perfectly.
15 years already.
Yeah.
When you look at our mission statement, the first component, just as a quick reminder to everyone out there that's watching us, is that we prevent harm.
Yep.
And one of the most important ways that we can do that, you see me smile already, is with our incredible community paramedicine program. I'm so proud that we have one, and all I get is positive feedback about it and the great job that you're doing.
Well, that's great. So when people ask me the goal of the program, one of the simplest ways to put it is to help people be healthy and safe in the environment that they choose.
And mostly it's in the home setting, is I'm sure with
it is.
Yeah, everybody likes to stay home. Hospitals are no fun. They're cold.
Right.
They're constantly bothering you. You can't get any rest. It's kind of an interesting process. What types of responses, what types of calls do you typically take as our paramedicine director?
I'm not sure there's a typical. There's a lot of lift assist and frequent calls for different things that get referred by the fire department. Because the program partners with Vibrant Health, and I have a nurse practitioner as a partner named Erica, we also work on some Vibrant Health initiatives, but we also have a broader range of what we can do as a community paramedicine program. So we've had some community referrals and been able to, see someone in their house and get them medication prescribed and then delivered, ordered through a pharmacy that delivers. So we've been able to have a broader range because we partner with them. Some of the frequent falls, we've had a lot of donations that just go around and knock on doors and call people till I get donations of durable medical equipment, so frequent falls, maybe they have a cane but they need a walker, or they need risers in the bathroom or handrails, and just trying to keep them from needing emergency services, both EMS and ER, to help them become autonomous and manage their own medical care, with ongoing care outside of the hospital setting. And that looks like a lot of different things. Helping people not be evicted so they're not homeless, because as we know, healthcare degrades when you don't have a stable setting, so
rapidly.
Lots of things.
Having you in the community along with your partner that's a nurse practitioner, that's an amazing benefit. You mentioned about making sure that prescriptions are up to date and are properly used. How does that work? Is there a fee associated with that? Are we able to get it through the hospital? Is the nurse practitioner able to order the drugs, or is that something we have a medical director looking at for us?
So this program, this particular patient that comes to mind, she had postpartum depression. She couldn't get into mental health services quick enough. She was pretty severe. And so we were able to go to her house. She did have to register as a patient with Vibrant so that she could then go in and order the prescription, and have her as a patient of Vibrant. but they are a federally qualified health center, which means they see uninsured, underinsured, or fully insured. They work on a sliding scale based on your income. So I believe her medication was like $4. Whereas me, because I have good insurance, it would be like $12.
Does the paramedic unit that you're assigned to, does it pick up drugs and deliver drugs to families?
No, not regularly. We have a couple of times, but again, our goal is to have people learn how and create the routines that they can manage their own care in a healthy way. So we have picked them up one time because, she was past due, and obviously certain medications, if you miss, it's really, really important. But we picked them up that day while she established the delivery system that we gave him for her information for. So once she established a delivery system, signed up with the pharmacy that's free of charge, then we didn't need to do that anymore.
That's spectacular.
Just to fill in the gap.
What a great way to do business. And that I think also the folks that are challenged with healthcare also have other challenges like transportation, like childcare, like the financials that you mentioned that can cause them to become homeless. And filling any of those gaps,
Yeah.
a big deal, and clearly supports our mission of preventing harm. Would you agree?
Yeah, 100%. I would say, not that I have numbers, but just from my own experience, probably 90% of barriers to healthcare are not healthcare. It's transportation, it's reliable food, especially for the diabetics. It's getting your prescriptions reliably, consistently, not missing them. And there's so many things that impact that. We do have a program currently that a patient can get transportation within Wyandotte County to and from medical appointments. So that helps a lot. We've helped a lot of people connect with that program and set them up. We've connected people with food pantries. I just spent a bunch of time going through a food pantry list that I had that was kind of out of date, so I called every single one. And because when you hand someone a list, hey, here's a list, go call 38 places.
Yeah.
It's overwhelming, and some people just don't have the capacity, the tools to do that. They have anxiety, they can't read. There's so many barriers. But putting it in a format that says what it is, where it is, exactly what they provide, the third Thursday of every month, whatever it is, so they can figure out before they call everybody, what works in my schedule, what works in my location, what works in my transportation, and be able to go and do that. We also have now a community health worker who can help sign them up for SNAP and, food resources as well. So again, just so many of the issues are not getting into the doctor, which it still can be, but it's getting to the doctor. It's not making the appointment, it's getting to it. It's having all those reliable things so that they don't degrade and need emergency services.
And there's no shortage of need in Kansas City, Kansas, is there? No, not without a doubt. So I'm a fire officer and I need your assistance or support. And I need it rather rapidly for a degrading situation, for instance. How do we go about doing that? How do we get that service, and would you be available to go on an as-needed basis?
So it's not structured that way. I have been able to respond that way on occasion because I do have like a schedule where we schedule home visits with patients and other things that make the program work. But I work Monday through Thursday, 7 to 5. And that is because my partner, nurse practitioner, she works 4/10s, and we obviously needed to match our schedules so that we can go out together. She's in the clinic on Mondays, so we're together 3 days a week. But
And they're fairly highly structured days. In other words, you have a schedule probably waiting for you when you walk in the door.
I do. And then, obviously on Mondays I have more referrals than I do through the week. So Mondays I also spend time calling the referrals and seeing if they want us to come do a home visit, later in the week. If we can address their need over the phone or through advocating. Sometimes it's just, advocating for them in different ways. I did recently have a captain call me on scene of a gentleman who had tooth pain, and I'll give it to him. We all know we've had people call for tooth pain and they haven't tried anything, but he had tried to get into a dentist. They were booked till September, or it was going to cost him $1,000 because he was on Medicare. And, I was able to make some phone calls and call him back while he was still on scene and get him an appointment for emergency dental visit, a day or two later. So I didn't have to actually respond to the address. He was able to call, and we were able to use the resources to get him in somewhere.
Would that be something that you would welcome? In other words, a telephone referral to help a company officer, acting company officer, figure out a problem and do the very best we can do for our community?
Sure, yeah. If I can answer my phone, I do. So
Good.
It was on my personal cell, which is fine. A lot of people have my personal cell. There's also the work cell, and the work office number rings directly to the cell phone. So
Call one or the other.
Either one, it rings directly to the work cell phone.
I know. I hate to reference back when I was in Washington, we had a really interesting case. It was a gentleman that was having a psychotic event and decided to disrobe. And when people would approach him, he would actually spit at them. And the company officer was wise enough. It was in the metro system, below ground, the rail system, subway, to call our street calls program, which is equivalent to yours. And they were able to respond. There was 2 units in Washington at the time. And they helped the gentleman, pretty much calmed him down, got him wrapped in a blanket, got him out of that setting, put him in a vehicle to take him to the psychiatric hospital, which is called DC General. And I reflect on that only to say the company officer didn't know what to do.
Yeah.
And there's so many times as a lieutenant or a captain, for me, that I can reflect back on, I didn't know really what to do.
Right.
By bringing that resource in versus the police, it probably saves several $1 million. And you're saying, huh? I think if the police would have arrived and tased this gentleman, it would have made the 6 o'clock national news. Remember, it's Washington, D.C. He wouldn't have gotten the help that he needed, probably as he begins to recover from the dramatic injury of being tased. He was doing nothing wrong other than he was out of his mind. Taking off his clothes is not good, I get that. But in seconds, they had him wrapped and willing to walk to, it was a soccer mom van, is what we used. And instead of embarrassing the government, paying literally perhaps millions of dollars for mistreatment, he got help. And I know you're thinking, thank goodness that story's over. It doesn't end there. We followed his care along. Again, there was 3 people assigned to each of the street calls units, a physician's assistant, a paramedic, and an EMT. And they learned that this gentleman continued to get better. They put him in, substance abuse was his major issue. They put him into a substance abuse program. He eventually moved to a halfway house. He eventually found a job. And about 2 years later, he was our guest speaker for EMS Week.
Oh, that's
so it
wonderful.
was tremendous success.
Yeah.
And again, I look on that and I see the wonderful programs that are out there. Certainly ours tops the list, and you're doing an amazing job. But it takes initiative, it takes insight, it takes being empathetic and sympathetic towards the patient, and then it takes great people to carry it off like you and your partner. So I can't thank you enough for that. Have you experienced any particular calls that would be noteworthy so that our viewing audience, all of our members, and perhaps even our general public would understand what your typical day might look like? Has there been any unusual things that you've had to deal with?
There's a list of things that might be considered unusual. On the mental health side of things, I'm not currently trained for that particular thing. I do some training and research and stuff on my own, and I'm hoping to get some more training as well. But we do have the CIT officers. They have added a few more. And then the health department has also recently added 2 peer support specialists.
What's a CIT officer? I'm sorry, I'm a newbie.
Critical intervention team, I
Nice.
think, is what that stands for. And they are trained in mental health de-escalation and techniques and just mental health care, and kind of how to address those mental emergencies. So.
And most of the folks that you deal with have some type of an illness, whether it's a substance abuse or mental illness or physical other problems or issues.
Yeah.
Fair statement.
100%.
What we found is the amount of calls that a person would send. We kind of thought at first maybe it was abuse, and I did not hear you use that word, which makes me so happy. And what we learned is they were rather sick, and needed that support and needed that help. They had nowhere else to go. And I think the firefighters began to learn that we could help the street calls people and get them to intervene at 2 or 3 in the afternoon, or we can wait till 2 or 3 in the morning and go there under emergency conditions and have to deal with somebody that may continue to be failing physically. So you bridge that gap, and I hope that we're able to expand the program.
Me too. Yeah, there was a gentleman in the beginning. I think he had been referred a couple of times over like 2 days, and I had talked to him, and he said that he would go to the hospital, he would be released, and go back home, and he was one of the few that realized he couldn't do it alone. He wanted assisted living, he wanted skilled nursing, he wanted step down care, he wanted help, right? He could not do it alone. He was desatting, it was a respiratory issue. And he told the crews that, like, it was in our reports. So he must have also told the hospital, and he was still sent home. So I was able to respond to the call that was active, have him taken to a different hospital, go to that hospital and just advocate for him. I talked to the ER case manager and the ER charge nurse, explained the situation, that we had been there multiple times in 2 days. He didn't want to go home and do it, like he couldn't manage it alone, and because we know a lot of patients want to go home and they need assisted living, but they refuse. He was on the other side of that token, and he wasn't being listened to.
Wow.
So he was able to get into long-term care.
But only because of your advocacy, which it speaks volumes for you as a person, but organizationally, what more could we ask? What more could the public ask? So again, I think we got to get that message out there. It's November, and it's getting colder by the day virtually, and the days are getting shorter. That's the only part I really hate about winter.
Yeah.
Any advice for the fire companies as it relates to providing care to folks? We have a reasonable number of homeless population. I don't think it's explosive, but there's certainly many folks that do live on the streets.
And it's definitely more the last 2 months.
Continues to increase.
Thanks to other cities pushing theirs out.
What advice do you give that captain or that paramedic that might be coming on an ambulance when it relates to any tips or need to get our community paramedicine intervention?
Do at least a street sheet and send it to me. Send me something. Send me a referral and some way to get a hold of them. If a lot of the houses don't have reliable locations, right? But they have a phone, or give them my card. And if they don't have the referral cards on their rigs, they can email me and let me know, and I'll bring some out. Just like with the Narcan kits, if their EMS unit's out, I can bring some out, or 41 can. And then we can try and connect them with, housing services. I've had a lot of donations that we handed out last winter as well for blankets, hats, gloves, tents, clothes, food, stuff like that. But we have a lot of resources that we can connect them with if they're willing.
It just brings me to a couple of closing questions. Do we train our paramedics and captains to understand the value and what services that you and your partner can provide in our community paramedicine program?
I have done presentations. I've sent out multiple emails, so if they're checking their emails, they'll get information as well. So I think this is a really good thing that you're doing as well, because it's a different way to get to them.
I love the idea of emails, but if you saw my reaction, today I'm going to get about 75 or 80. I'm not going to have the time to answer them all or even read them all.
Right.
So I would ask everybody to provide a little grace and forgiveness when we think we send out an email and a problem solved. I call it MOM or MOM, manage by memo. When you get out in front of a group in this meeting or others, oh boy, the ideas begin to flow. You can sort of connect the dots using a crude analogy, meaning that, boy, I wasn't able to help that person. I know maybe if I had some intervention assistance that person may not be calling us every day. So I thank you for that. May I get some of those cards from my
Yes,
car? I would love to have
definitely.
those. Again, I believe in absolutely everything you're doing. And I would simply ask, did we miss anything about our community paramedicine program that you would like to share? Any additional thoughts?
Sure. I would like to say, if in doubt, just send it our way. I can always call and see if there's anything we can do to help. But if you don't send it, especially with a phone number, that'd be really helpful.
Do many of the homeless people have telephones?
Yes. Yeah.
Surprisingly enough.
Surprisingly enough, all the ones that we've dealt with, once we found them and connected with them, they do have a phone number, and sometimes it changes, and that's fine. And ironically, the only two of the referrals that we have dealt with that don't have phones have a residence with no phone.
Wow.
So,
Anything else?
we don't have resources for hoarders. And if it's self-neglect,
There's no resource in this entire county government with the health department and other groups that cannot help a hoarder
not
currently.
currently that I can call and say, here's
Wow.
this address. If you refer to the state for the unsanitary living conditions, self-neglect, unable to care for themselves, then they have more resources and finances available. I know of some situations that they offer to come get a bulldozer and pull all the crap out of a guy's yard just to get to his residence, right? Like they have a lot more
It's sad.
stuff than we do. And as we know, I could throw out some names and addresses and people would know, calling the state doesn't force them out of their home, because there's plenty that we wish we could get put into assisted living, but that's not what the state does. They have additional resources and funding that we don't have as well.
Do we add it to CAD notes when we do find a hoarder home? Because again, that's impactful when it comes to responding there for a fire.
That is a great question that I don't know the answer to.
We'll check on that. But again, cannot thank you enough for appearing here today. Jessica, I think the work you do is incredibly important. And it is a person that clearly you have a big heart to take care of people along with your partner. Because I know at times it's not a very pleasant job, but you understand the end result. And again, I would have to say, you light up the scoreboard when it comes to our first mission statement goal, and that is to prevent harm. So I cannot thank you enough, and thank you for being here today. With that said, we're going to be going right into burning questions next. And thanks each and every one of you for taking the time to watch it. But stick around. Burning questions are coming right up next.
Okay, my question would be about the procurement process, regardless if it's an emergency purchase or a non-emergency purchase. How can we reduce their turnaround time? Because right now it's taken about a month or more to get things going through, and a lot of vendors are not very happy with the turnaround time that we have.
Well, it's going to be difficult. The expectation is we get that information together and move it through the system according to what the needs of the procurement department are. Sometimes we go through emergency purchases, most recently with a pickup truck and, of course, 3 pumpers, and that took days to just a few weeks at the most, but that's an unusual process. The hope is that we can plan a little bit of time ahead, somewhere between 2 weeks to 30 days when we're making a general standard purchase. For instance, if we're buying an item that we have in stock and we're not going to use, for instance, like a tire might be a great example, and we need to have a dozen on the shelf, probably when we get down to about 7 or 6, maybe even 5, it's time to go ahead and buy those other 7 tires, if you will, knowing that we're going to use the rest of them. So I hope that helps. It is outside the control of the fire department, but I also don't want to throw our partners under the bus. Procurement works very, very hard. I can tell you, Miss Julie Herr is amazing at her job, which she does to make sure that all these documents are processed. And then the other item is, I wish we had more resources, but I don't think there's a single department head that wouldn't agree with me. We really have to be lean and mean simply because that's our tax base. I hope that's helped. I hope things are going great. I know that there's a new boss out there with Chief McCoy. Tell him hello from the Rube, and you have a great day. Thanks, Kason.
Since it appears that the prospects of lifting the residency requirement has failed to gain any traction, what other plans does the department have to increase our hiring pool of qualified applicants?
Yes, in fact, it failed to gain traction. I doubt it's going to come up again, and I would suspect that we're going to continue to ask members to live inside of the UG. We have just hired what I think is a great person working in the recruitment process, and that, of course, being our very own Chief Chad Womble. We are working closely with the HR department to develop what looks like, we think, is a really, really good possibility of putting together firefighter recruitment and new information. We're working on the brochures to update them. We're currently working on the process of how a person gets into the system and all the requirements. Once we have that ready to go, we'll quickly review it with our union, get everybody on board, and we'll get that started. Probably early into 2024, there'll be 34 new firefighters hired. So we do have a big challenge. We do have to work closely to bring in as many paramedics and, of course, train as many paramedics as possible. So we're looking forward to the challenge, whole new direction, whole new organization at the top, if you will, of both the county government, with Miss Bridget being our public safety director, myself, Chief Womble, relatively new position with Chief McLean and others. So look for us to go. We're hoping to get a lot of help and support from folks like you and everyone out there. So I hope things are good at Pumper 16, and I hope that you folks are enjoying the new station, if not now, certainly in the immediate future. Thank you. All right, that has it. That's a wrap, as we say in the business. Truly appreciate you taking time out of your very busy schedule to be a part of putting out the fires.